Should businesses be protected from coronavirus-related lawsuits? Republican leaders have said any future economic aid package will pass or fail on this issue. We'll start the conversation with former Republican Congressman Bill McCollum of Florida. He also served as the Attorney General of that state, and he joins us from Florida. All right, Bill, should businesses be protected from future lawsuits?
Well, I think most of them should be, Larry, because the fact is that we are trying to come out, or will be trying to come out of a severe economic situation in which small businesses, particularly, are vulnerable already. And to have litigation going on about connections to the virus itself, particularly those that may be charged with some aspect of the actual disease or some precipitation or aggravation of it, strikes me that's wrong. And the same thing's true with the doctors and the hospitals and all the caregivers that have been out there giving care. It's not easy. In normal times, you'd never do that. But in this situation, I think it's absolutely essential.
But you put the lawyer in a difficult spot. What about those, maybe few, who do wrong?
Well, people are obviously going to have done wrong in the sense of simple negligence. So maybe the standard shouldn't be a total prohibition, but it ought to be some willful negligence or something of a higher standard than what we call simple negligence, which means that a person does something that a reasonable person might not. And that's actually a very low standard, but it's the standard in the civil court of law today for most things. So if you raise the standard, then maybe you don't have to actually prohibit the lawsuit. You just simply restrict it to those really bad violations where somebody's grossly negligent or willfully negligent.
Move to other areas. Trump, on opening up the economy, said, will people be affected? Yes. Will some people be affected badly? Yes. But we have to get our country open. All right. Is that putting economics over health?
Actually, I think they both go together in this case. The real reason we went to the shutdown, and most of the places around the country had to go there, was because we did not have the supplies, the equipment, the hospitals, the doctors, and we didn't know how bad the virus was going to be. So now we have a lot more equipment. We don't have everything we want. We don't have all the test kits. We don't have all the masks, although they're being produced very rapidly right now. But we have enough to be able to save a lot of lives and handle the situation when people become ill. Larry, this country was based on risk. We all took risks as Americans years ago. Our ancestors, anyway, did. When the Ohio Territory, the Northwest Territory, was settled, incredible number of plagues and diseases, if you read back on history, that our forefathers withstood. A lot of people died, but a lot of people lived. They didn't shut down their businesses. They went on. They accepted some of that as a reality of life. Same thing's true of war. We don't like casualties. None of us do. But in a way, we're in a war. It's not the same exactly, but we are. So if we can minimize them, we save every life we can. We take every step we possibly can do, which we're in the process of doing. I think we have to reopen the economy because otherwise we're not going to have the food supply. We're not going to have the ability to regain the status of living to which I think all of us want children and grandchildren to have.
Easy to say unless it's your father.
That's right. And I've thought about it myself because I'm up in years a bit, not as young spring chicken anymore. I'm in one of those vulnerable categories. But the reality is that I think that's something that is difficult for everybody. When somebody passes, and I had a friend, a very good friend, very recently, who died of the coronavirus. I read it in the newspaper, didn't realize it until it happened. And did that sadden me? Yes, it did. And I think all of us are going to know somebody who's been touched by the illness and probably somebody who's passed away from it. And there are going to be more deaths. But that's inevitable. That's going to happen whether you have a shutdown or not. And unless we get some miracle drug in the next few months, and we all hope we do, we just can't sustain a shutdown for as long as it would take to get a vaccine.
Congress has approved nearly $3 trillion in COVID-19 relief. Is this going to be enough, do you think?
I don't know what the right dollar amount is, but I think the sooner we get the economy going again, the less we're going to need. The question is going to be trying to help these businesses, especially the smaller ones, survive. Some of it's happened for about 3 months, but if we continue to have people not go out, and by the way, that's really a key to opening the economy again. You can say we're opening it, but if people don't choose to take the risk themselves and go out, and do social distancing and act the right way, the economy is not going to come back quickly. And so the answer to the question is it depends. If we don't see a return, at least to partial normality in the very near future, there will have to be some more, spending to help keep some of these businesses alive and to allow people to take money home, which it's only a short-term thing we've done, even though it's a lot of money.
Your governor, DeSantis, has said that the relief fund should not include aid to states for financial obligations that predate the pandemic. What do you think of that statement?
I think he's made a very astute statement. We cannot, as a nation, afford to bail out all the states for problems and obligations that they've had in the past. What's going to happen, Larry, is many state revenues are going to be affected dramatically. And the consequence of that means that state services, some of them, are going to have to be cut back. Many states, like Florida, have constitutional mandate on the legislature. They have to have a balanced budget every time. They can't operate like the federal government in deficit. So there'll be some really hard choices. I noticed that the budget in Florida that was passed by the legislature a couple of months ago has not been sent to the governor yet. I think the reason they haven't sent it is because they know they're going to have to go back and readdress this, and it may happen sooner rather than later.
700 licensed nursing homes in Florida. The federal government is considering rolling back infection control requirements in such facilities. What do you make of all that?
Well, I am one who really believes that at the nursing home level, where you've got a lot of senior citizens, you've got to be super cautious. And I would, by regulation, hold the nursing homes strictly accountable. Make sure that everybody who comes into that nursing home is pre-checked. Make sure that every effort is made to sanitize. It is absolutely essential, because if you're in a nursing home, you're not just elderly. You've probably got real serious problems, and any infection of any significance is going to be potentially terminal.
A day after Trump indicated the White House's task force would be winding down, he tweeted now that it'll keep working indefinitely. What do you make of that change?
Well, I think that working is important, and working indefinitely is, a big word to say that. The reality is that I think it's all right. You can't know for sure about a lot of these things at the time they're made. The president's going to be second guessed on a lot of things he says and does. Sometimes he says things that are quite outrageous. I know that, you know that, and anybody watching this knows that. But the question is going to be judged on what he actually does, the decisions he makes, and whether or not the outcomes are satisfactory to the general public. They're not going to hold him, in my opinion, accountable for being able to have kept this virus from doing the things it's been doing. But they're going to hold him accountable, the public will, for how we come out of it and what happens from here on. I really think the next few months are going to decide his political fate, much more than the last few.
He's not allowing Tony Fauci to testify before the Senate, before the House, rather. He can't testify before the Senate. What do you make of that? Why can't Fauci
Uh,
testify anywhere?
Well, he probably should be. I think that's political. Be truthful. Nancy Pelosi has gotten very, very acid in her views with respect to the president. The partisanship over there in the House at the moment, which is my old body, is the strongest and the worst I've ever seen it. It came out of the impeachment process that way. And if you recall the night of the State of the Union, when he basically snubbed her, didn't take her hand, and then she got picked and tore up the address, if you remember that on national television, ever since then it's just been really, really bad. So that's probably why he doesn't want Fauci over there. I don't think it's to keep him from saying anything. I think it's simply because of the relationship and it being so harsh, the control being under Congresswoman Pelosi at the present time as Speaker.
What did you make of calling the Senate back and the House doesn't come back with this pandemic going? Why, if you were a senator, wouldn't you be a little apprehensive?
Oh, I think some of them are. They're wearing masks now, which is good. They should be doing that. They are being cautious. It is a difficult time, and it's difficult to clean the whole place all the time to keep it that way. But if you restrict the people coming in, which they are right now, we're not having crowds, the public's not visiting the Capitol, and you have a secure office area, and you're just intermingling with your colleagues, and hopefully staff, very limited staff. I think it's doable. I think that's just like any other business opening. And we're encouraging that to happen right now in many parts of the country. So I'm really not against it. I think the House is going to need to come back in, and soon, probably in the next month, they will. They'll just have to.
Bill, in closing, what do you make of all of this? We've never had to deal with it before. What's it like for you? You're at home, I guess. What do you? Where are we going with all of this?
Well, it's going to be very dramatic, Larry. Yes, I'm at home. I've been at home, working from home, working remotely since the end of March, early in mid March, I guess. And all of my colleagues are. I'm in a big law firm, and they're doing it worldwide. I think when we come out of this, several things are going to happen, Larry. I think, first of all, that businesses, law firms, but all kinds of businesses are going to do more remote working if they have that capability. If they do the type of work you can do remotely, I think a lot of office space is going to be empty, which may be a difficulty for the economy. I think that regulations in certain areas are going to wind up getting changed because in order for the businesses to come back, they're going to have to change some of the rules. Many of them are state rules, by the way, not federal, in order to let hair salons operate. Maybe somebody operate from not one location, but from their home or some other location. There are going to be a lot of changes, and for the near term, I don't know what the long term is, but I can guarantee you the near term, it's going to be a very different world out there for us when we come back. We're going to be wearing face masks. We should be, and we should be distancing for the foreseeable future. Now, I do know there are some drugs in development that look very promising. And so all the cautious words that Dr. Fauci and Dr. Bricks have said are appropriate to this, but I'm an optimist. Remember, I was a Ronald Reagan optimist. I've always been that way. I feel very committed to our country. We're free, the greatest free nation in the history of the world. We're going to survive this. We shouldn't be down about it. We should be upbeat. We should go out and do our part, but do it prudently. Be cautious, but don't be too cautious. Go out when you need to go buy something, and there's a store that's open now. Wear your mask, distance. Hopefully that store is abiding by the rules, but go give it. Go pay them something. Help that economy come back.
The very practical Bill McCollum. Thanks so much. Always good seeing you, Bill.
Good seeing you too, Larry. Thank you.